We're talking to Dr. Paul Henny in Roanoke, Virginia. And if you're a new patient looking for a dentist, one of the questions you may not think to ask is, what is the philosophy of the dental practice? That's huge in importance.
Well, I think a lot of people aren't aware that dentistry, like medicine and so many other things in our society and world today, has continued to progress over time. And that the historical kind of repair-oriented ways of approaching dentistry have now become kind of dated, although they are practiced quite frequently still in most practices today. But
so you're saying most practices are repair-oriented?
Yeah, most practices are oriented towards finding a problem and fixing a problem. Really very similar to the way most physicians work. Most physicians are so busy and they have so little time to spend with their patients, they really don't have a whole lot of time to figure out why the problem occurred in the first place or what they could do to prevent it from occurring again. They just focus on the immediate problem. You have an infection, let me write you a prescription for an antibiotic, call me back if it doesn't work out, that kind of thing. And dentistry has functioned in a very similar way for a long time. People come in.
Got a problem, I need help, you fix it, they go away.
Yeah, or they come in just to get their teeth cleaned and the dentist identifies a problem and then they're scheduled for a repair.
So there's a better way.
Yeah, there's a better way, mainly because of our understanding and technology and research and products and so forth have evolved to the point where we can actually truly prevent the three main diseases that occur in dentistry today. That would be decay of your teeth, infections of your gums, commonly known as gingivitis. I think most people are familiar with that. And the third one being periodontitis, which is infections of the bone around the teeth. So we're actually at a place where we can progressively prevent those things with new strategies and thinking about things more on a biologic basis.
Does that what causes tooth decay, that I have a problem and my teeth are soft or they're breaking? Is that at the root of that?
Yeah, I mean, dental decay, the appropriate way to think about dental decay is that it's an infection. It's what we recognize as dental decay, a brown spot on your tooth or tooth breaking down eventually, is the end phase of an infection. It's caused by bacteria that release acids that essentially dissolve the enamel and other structures of your teeth down to the point where it discolors initially and then breaks down physically. So dental decay is an infection, gingivitis is an infection, periodontal disease is an infection. And so if we don't think about these problems on a bacteriological level, then we are not really being preventive in any way. We're just being reactive.
So you're going upstream before these problems occur, and you have techniques now that can keep those problems from occurring or slow them down?
Yes, we have ways, for instance, to actually test what bacteria are present in your mouth and the ratios of them. And so a more appropriate way to think about the mouth is that it's a microbiome, meaning it's a combination of hundreds of different bacteria that interact with each other in favorable and unfavorable ways and in ways that compete with each other. And over time, certain bacteria can predominate due to a number of factors, your diet being a big part of that, your oral hygiene routine being another part of that, and so forth, and even the things that you use to clean your mouth, such as what kind of toothpaste you use or what kind of mouth rinse you use, influences the nature of that microbiome and may in fact throw it out of balance to the point where actually what you think you're doing is helpful when in fact it's actually throwing the system out of balance and accelerating other problems.
So if I come to you as a patient, I'm 40 years old, and you can test for that and tell me the health of those little bugs in my mouth?
Yes, they've developed some very sophisticated genomic-based saliva testing now, then we can tell basically all the bacteria that are present in your mouth, in addition to the ratios. And the ratios and percentages are important because they need to be present at a certain percentage to really be able to cause pathology.
Wow. So I can come to you, and with your biological information, you can help me keep a healthier mouth and my teeth longer, and I may not have to go into dentures or have a lot of crowns.
Right. We could be, in the same way that your physician can draw your blood and do a blood analysis and look at certain aspects of that analysis and project that you have a higher percentage of heart disease or you're at higher risk of heart attack or something like that. We can do the same thing. We can actually analyze your microbiome very objectively, and we can perhaps even project that you're heading towards having problems with gum disease or other things.
Wow.
And to even expand that topic out even more, we know now that the bacteria that are present in our mouth don't stay there. They circulate throughout our body, both through our swallowing as well as getting into our bloodstream through our gums, particularly when our gums are inflamed. So a common misconception in dentistry is that it's kind of sort of normal for your gums to bleed a little bit. Can you name any other part of the body where we consider it normal for it to bleed if you just touch it lightly?
Yeah.
And that's a leading question, of course. The answer to that is no. And so it is actually not normal for our gums to bleed at all. And when our gums are routinely bleeding, we're actually looking at small microcapillaries within our gums.
So when I come to you, and this is quite unique. I mean, you are actually looking at my mouth in a preventative way.
Yeah, I mean, we can now, in a very objective, measured way, see where you are, get a benchmark of where you are right now, what disease states are present, or maybe even with all these testing tools now, even project forward what's likely to happen. So, for instance, if you had chronic periodontal disease, we know now that the bacteria that cause the periodontal disease can circulate throughout your body. It's being found in autopsies of patients that have Alzheimer's disease, for instance. It's found the same bacteria that are present in the mouth are found in plaque and coronary arteries, for instance. So what is in the mouth does not stay in the mouth, particularly when your mouth is in a state of some disease state.
Some disease, yeah. So,
Right.
So your mouth is kind of a gateway to all kinds of functional problems.
Absolutely. It's a good metric, really, that you can look at in a fairly objective way to see what's not only happening now, but what's likely to happen in the
Do you
future.
think we're going to get to the point in medicine where, like, we've gotten to the point where you take a blood sample, we're going to take a mouth sample to see the state of health? You think that's where you're headed?
I think we're at the point now where that is the appropriate thing to do.
Really?
I think it would be almost really missing the ball. Malpractice is probably too strong of a word, but it's really missing a huge opportunity to help people avoid problems as well as manage down issues with the testing and management tools that we have available right now.
I know a little bit about your practice, and you have people coming to you from a pretty broad area, but if I looked at just the Roanoke, Virginia general metropolitan area, you're one of the few that are doing this. I mean, this is really sort of ahead of the curve, isn't it?
It is. I mean, there are dentists all over the country and the world that are practicing more in what I would call a true preventive model. But they're few and far between, mainly for the reason that dental insurance is not structured to support it. Dental insurance is structured to support the old repair model. So dental insurance essentially won't pay for anything that can't be objectively observed, measured, shown to them, demonstrated to them. So historically, they don't want to really pay for anything that represents true prevention beyond, maybe paying for you to get a fluoride treatment, in which they'll do very reluctantly. And oddly enough, even fluoride treatment is kind of going out of favor now because of the new advancements that we have available to us
So this
today.
does lead to the question of expense. Are these kinds of tests of your mouth, are these expensive? If it's not covered by insurance, can I afford it?
No, they're not terribly expensive. You can probably get a saliva sample back for maybe $150, something like that. But it would probably be one of the most important pieces of information you could possibly have, because if you had an infection, for instance, if you had an infection in your body, wouldn't you want to know what what bacteria are present so that you could prescribe the appropriate antibiotic and any other strategies? Wouldn't you want to know that?
Sure.
Because otherwise you're just shooting in the dark, using just general shotgun approaches and hoping that you're not only hitting the target, but you're eliminating it. And just like anywhere else in the body, certain antibiotics are not appropriate for certain bacteria in certain circumstances. So you can put a patient on an antibiotic that can do nothing to prevent or eliminate the oral infection, and just give the patient problems with their GI tract. So we're able to kind of micro-target now, because we have this very specific information about what's present and what quantities present, so we can develop strategies to really eliminate things for the very first time.
So if I'm a new patient coming to you, do you automatically apply these techniques and procedures, or do we have a consultation to find out what my goals are, or how does that work?
Yeah, I mean, I prefer to conference with everybody in advance to try to get aligned with what
they want, what they
what the
need.
purpose of our relationship is, what their goals are. I mean, most people that come to me and enter this practice have pretty specific goals about what they want to achieve, and we'll sit down and create strategies that are most appropriate to achieve those goals. And some of those goals are, hey, I've been so frustrated by repeatedly having problems with my teeth, breaking down, decay, and so forth. And I've never really had success working with dentists to truly prevent these problems before. What can you do to help me?
What can you do to help?
So these are becoming more and more frequent conversations that I'm having with people, that they're coming to me out of frustration. It's not that they haven't been participating with dentists. They have, in fact, been very devout about doing that. They've been very devout about doing everything they've been recommended to do, and yet they're still failing. So that's where things are changing. We now have so much more information now, and measurement tools and strategies that can actually address these problems for the very first time in many cases.
Wow, this is interesting. Well, if you're watching this and you are looking for a dentist, or if you're not pleased with the health of your mouth, I think an obvious choice would be to contact Dr. Paul Henny. The information is at the bottom of your screen. And thank you so much. Very informative.
Thank you, Stan.